Good morning, everyone.
Good morning.
Good morning.
Thank you.
It's about 1:30 a.m. our time. And we're Dr. Sujan and I are so thrilled to be here. I really want to give my appreciation for being able to join you all today in this session because it is such an important topic. The AI in healthcare and AI in education. I just want to tell you a little bit about how I got here because it definitely was not my background a couple years ago. My own journey began when I was asked to join the North Carolina Central University AI task force. And I joined with multiple disciplines. And we did a lot of work with Duke and UNC Chapel Hill to figure this all out. And so I was really working along with many different interesting individuals, exploring how this emerging technology could be integrated into our curriculum, which Dr. Sujail will talk about, and healthcare systems as well. And it really opened my eyes to both the promise and the challenges of AI. And we began to ask deeper questions, which led us to explore where AI in healthcare really began, because it seems so new to us. Or really was it? And why has the idea seemed to have just emerged in the past couple of years? And most importantly, we had to figure out where it's taking us. So that curiosity really led me here today to explore all of those questions with you. I'm looking forward to hear all of the speakers here today and to share some of what I have learned. As mentioned earlier, it's really important for us in the university to stay informed of what's happening in the healthcare systems as well. And I do want to add that I still work in the hospital system and in rural care. I do hospice as well. We need to do this because we need to align our curriculum with current practice. So going to the timeline, I just want to start with some historical context, and you've already got some of this anyway, but AI in healthcare really began as early in the 1970s. And although nursing really wasn't involved in it, we had systems like MISIN, which was that artificial intelligent expert system that was developed at Stanford University, and it was really to help identify bacteria causing severe infections, and then it would recommend appropriate antibiotics. And then you go to the late 1990s, where nursing specific applications began to emerge. And I've been practicing long enough where I can remember some of this, because some of us nurses, at least in the United States, we kind of were, putting our heels to the ground. We liked our old way of doing things. So it was really hard for us to really embrace some of these tools that were being were being introduced to us, including the way that we started to document. So we liked our old paper, and all of a sudden we had electronic health records, and we were documenting on digital formats. And all of this really started to allow early AI systems to process patterns in nursing notes and care plans. And nursing informatics began to take root as recognized as a specialty, laying really the groundwork for today's AI-driven decision support tools. And then, of course, in the 2000, we were all supposed to be on electronic health records and clinical decision support systems. And as we see in the 2010s, we start seeing more advanced tools that could predict outcomes in healthcare and nursing. What was nice about this is because some of these advanced tools could read and extract key information from our clinical notes and our nursing documentation, and even our discharge summaries that would flag warning signs in healthcare. So things like, if a nurse would say something like patient feeling dizzy or weak, that might trigger a fall risk alert. It could also summarize records or create clinical reports automatically. So again, we've been using it, but for some reason, it just feels so new to so many of us. And then, of course, in the 2020s, we're seeing a significant leap forward. Tools like Nuance Docs, which allows real-time voice to text transcription during patient encounters. I'm using this personally in hospice. So I go out to rural communities and I see people in their homes. I use real-time voice when I'm transcribing my encounters with my patients. It's reduced my charting time. It's also supposed to improve documentation accuracy. I will say that I do have to go back and check everything because it doesn't pick up everything I say accurately. We have predictive staffing models that use AI to forecast patient acuity and volume trends, and this helps your nurse managers optimize staffing levels, and it's supposed to also help reduce nurse burnout. We have a huge nurse burnout problem in the United States. I'm not sure how it's like there, but we do have it here, so we have to figure out ways to reduce that. And again, in home health, we have AI-enabled devices and platforms that monitor patients' vitals remotely. We can flag trends before issues escalate. And there are also increasing emphasis on ethics, bias, and equity in the development of the use of AI tools. And this simply means that hospitals are now evaluating algorithms for fairness across race and gender and socioeconomic status. And this is really notable in major institutions here in North Carolina, like Duke University and UNC Chapel Hill. They have launched quite a few AI initiatives that are really driven by nurses today. Next slide, please. So again, why does AI feel so new in healthcare? I don't know about you, but it certainly does for us. And it's because technology has finally caught up. And I think with ChatGPT and people are using it more, it's kind of at the forefront for us all. So again, for years, AI was more an idea than an application. But now we have this computing power, we have these cloud platform and massive data to actually make these tools work accurately and in real time. We'll also say mainstream visibility has exploded. So again, thanks to
नीचे देखिए तो नजर आता है
ChatGPT
नहीं नीचे वहाँ
and similar tools, AI is no longer something that's hidden behind the scenes. It's accessible. We're using it personally, and healthcare professionals really are realizing that they're interacting with AI, even if they don't call it that. We also have healthcare pressures and demand innovation because of staffing shortages here in the US. We have a problem with staffing shortages, particularly with nursing. Part of that is due to burnout, like I was talking about a minute ago. And also budget constraints are forcing systems to find new ways to deliver safe and efficient care. And so AI isn't a luxury, it's really becoming more of a necessity to support overwhelmed teams. Ethical concerns and health equity, with that growth comes responsibility. We've really seen how on-check technology can worsen disparities. So nurses really are key to making sure that AI tools are fair, ethical, and patient-centered. So nurses are now at the table, and historically AI tools were created without input from nurses. And the people, it's important to realize that because nurses are the people who spend the most time with the patient. So today, nurses are contributing to the algorithm design, we're contributing to policy reviews, and we're also contributing in AI implementation and practice. So we're not just reacting to AI anymore, we're shaping what it looks like in care delivery. Next slide, please. Thank you. I want to really point out and emphasize for you all why nurses must be at the table. So nurses are the largest healthcare workforce here in the United States. We have nearly 4 million nurses. They provide continuous frontline care more than any other provider. So decisions made by AI tools directly affect nursing workflow. It affects our workload, and it also affects how we interact with our patients. So nurses today, we know that nurses know the whole patients. we see more than clinical systems. We understand their social, we understand their emotional and environmental factors that influence their health. So insights from nurses are crucial to design AI that supports holistic patient-centered care. I also want to add that nursing judgment is not replaceable. AI may suggest actions, but nurses use context, we use compassion, and we still use critical thinking to make the final call. So without nurse input, AI tools may oversimplify or even miss nuances in real world patient care. So we have to be careful with that. To prevent bias and promote equity, so we have algorithms that often reflect the bias of the data and developers. So nurses really, especially from diverse backgrounds, help to ensure tools are equitable, ethical, and inclusive. So we we really play a pivotal role in that. Next slide, please. What's really awesome, I think, is how AI is changing nursing roles. So we already see that AI is shifting the landscape of nursing, both in practice and in professional development. Traditional nursing roles are evolving to include greater interaction with data, to include greater interaction with technology and interdisciplinary teams. So that we see here new titles are emerging as nurses engage in AI tools and as nurses shape policies and as we lead innovation. So some examples of new and evolving roles include the nursing informatists, so they integrate data, information, and knowledge to support clinical decision-making. And again, as alluded earlier with other speakers, this is all about improving patient outcome. Clinical AI specialists we have now that works at the intersection of AI systems and clinical operations. And these nurses help to evaluate and also implement and monitor AI tools in patient care. And then AI ethics advisors in healthcare, which is so important to ensure that ethical use of AI by evaluating tools for, again, fairness, transparency. And then you have algorithm review board members as well. So they participate in hospital committees that approve and oversee the use of these clinical algorithms. And again, all of these roles reflect a broader shift towards data-informed technology, which is really going to shape leadership in nursing. Again, nurses are now key contributors to innovation. We are not just simply users of technology, but we are now co-designers and guardians of patient-centered AI applications. And next, we can see some real tangible AI tools. And so next slide, please. And that are already being used in practice. And these are, again, aren't theoretical. They're happening right now across healthcare systems in the US and globally. We have Nuance Docs, which is that voice to text that transcribes conversations into real-time electronic records, health records. It's being used here at UNC Health and other systems, and it's the importance of it is supposed to reduce documentation times, so nurses can focus more on patient care rather than always being at the keyboard and not looking at your patients. We have sepsis prediction algorithms that are built into platforms like we use Epic. Again, all these tools alert nurses to early signs of things like sepsis based on real-time vital signs and lab data. This is important because, again, they've been used for a while because they support faster and life-saving interventions. And we have wound assessment apps, and this is really, these are nice because they are used in a lot of rural settings or long-term settings to analyze wound photos and track healing and help us decide on care plans in regards to different types of wounds. I use them in hospice. In hospice, we have patients that have lots of wounds, And in the past, we used to have to take digital pictures and figure things out ourselves. And now apps such as Swift Medical are helping us guide these clinical decisions much more quickly. We have fall risk predictive tools that are integrated in these clinical decision systems that flag high-risk patients, and we have virtual nursing assistants that provide education and triage support to patients after discharge. And then, of course, remote monitoring, we're using that quite a bit, especially with Mayo Clinic and Kaiser to support at-home care. And so again, and last, I do want to also say for staffing, we have AI staffing tools like Chronos that predict analytics to help managers schedule more effectively. So all of these tools really enhance decision-making in healthcare. They help to reduce risk and support nurses in delivering high quality and efficient proactive care, I might add at that. Next, please. What I do want to say is that AI is not replacing nurses, and I always have to share that with my students. Nurses who use AI may replace those who don't. So that's really important concept. And this isn't really meant to scare anyone. It's meant to challenge all of us nurses to make sure that we stay current. We should not see AI as a threat. It's a tool, just like your stethoscope. It's something that nurses must learn to use well. Next, use a nursing perspective to shape the future of healthcare technology. Nurses should not only use technology, we must help design it. AI doesn't reduce our humanity. It should give us more time to express it. I'm still on the previous slide. I'm sorry about that. So AI doesn't reduce our humanity. Think about this: if AI can reduce charting time or alert us sooner to changes, we can spend more time doing what we can do, comforting patients, educating, and then advocating for our patients, and also connecting patients with family. Bringing a vision. Imagine this: a shift nurse, where a nurse asks their AI assistant what changed most in the last 12 hours and get a smart, synthesized, risk prioritized answer. That's not science fiction anymore. It's where we're headed, and nurses really must shape how we get there. We've always been at the heart of care, so now we need to be at the forefront of innovation in healthcare too. And then finally, my last slide, I just want to say that again, nurses have always been at the heart of care. As AI transforms in healthcare, it's not replacing us. It's really calling us to help lead this innovation. So whether you're at the bedside or in the classroom or charting next, remember the future of nursing includes technology and an AI, and it just depends on all of us to shape it together. And thank you so much.